Go.
Hi, how are you doing today?
I'm good. How are you?
Good. My name is Ariel, and I'm going to go over your allergy drop treatment with you today, okay?
Okay.
So we have your vial mixed, and you are going to receive a drop from your vial today
Okay.
in the office.
Yes.
So if you will just look at that and make sure that that is your name and date of birth on that vial.
Yes, ma'am.
Okay? So I'm going to give you one drop from the vial, and it is going to go under your tongue. You'll hold it for 2 minutes and then swallow, and then we'll set a timer for 10 minutes just to make sure that you don't have any kind of reaction while you're here in the office, okay?
Mhm.
So before I give you your drop, there are some questions I'm going to go over just to make sure that everything is still fine. Have you had any kind of asthma symptoms, fever, trouble breathing, anything like that?
No, ma'am.
Okay. Have you had any changes with your medications?
No, ma'am.
Are you taking any medications that are a beta blocker?
No.
Okay. Have you taken an antihistamine?
Yes.
Okay. And have you seen any of our doctors today, in the office or telehealth?
No, ma'am.
Okay. So since you verified your vial, I'm gonna go ahead and give you that one drop.
Okay.
So I will show you at home. Whenever I say one drop, a lot of times people think I mean an entire dropper full.
Okay.
But one drop is literally just one drop out of the vial, okay?
Okay.
Alrighty, so if you would like to pull your mask down, this one drop is gonna go underneath your tongue, okay?
Okay.
Alright, so if you'll just hold it for 2 minutes, I'll set a timer, and then we're gonna go over your paperwork, okay? Okay. This paperwork will be yours to take home so you can read it more in depth, but just kind of an overview, just telling you a little bit about allergy drops. So you are allergic to certain substances, so this treatment was recommended by your doctor. There are other things that you can do for allergies, such as shots, but the drops were recommended for you. Okay. Common risks associated with allergy treatment, the first one being anaphylactic shock. So anaphylaxis, are you familiar with that term at all? A little bit? Yeah. So if you ever feel like your throat is closing up, you just cannot breathe, your eyes are swelling shut, that would be an anaphylactic reaction. So nobody who's ever done drops has ever had one, but we do want you to be aware. And we'll go over how to use an EpiPen later, okay? All right. So also some more common reactions would be itching of your mouth, your lips, your ears. You can just take an additional antihistamine to kind of subside those symptoms, okay? Any questions so far? Nope, okay. Alrighty. Okay, so like I did earlier, every time that you come in to get a new vial, just make sure that it has your name and date of birth on that vial. And then also, the questions I asked you earlier, we'll go over more of those reasons not to take drops, okay? So if you ever have a fever over 101, if you're wheezing or if you have any tightness in your chest, if you've also received any kind of immunization within the last 24 hours, don't do any drops, okay? If you just exercised or you have an elevated pulse, if you're beginning to take an antibiotic for an upper respiratory infection, if you become pregnant, or if you've had any kind of cardiovascular surgery or any surgery that affected your breathing in the past 6 weeks, okay? All right, so you can go ahead and swallow that drop. Okay. And now I'm gonna set a timer for 10 minutes, okay? Alright, so then an EpiPen will be prescribed to you. We'll send it to your pharmacy and I'll show you how to use those too, okay?
Okay.
Alright. So regarding beta blockers, the reason that we asked you if you were taking a beta blocker earlier, it's really important with allergy treatment that you do not take a beta blocker while you're doing your drops.
Okay.
If you did have an anaphylactic reaction and needed to use your EpiPen, the EpiPen would not work because of the beta blocker, okay? So if you would like to discontinue your allergy treatment at any time, we do have a waiver that you can come in and sign.
Okay.
Otherwise, as long as your payment is kept up and your follow-up appointments with the doctor are kept, we will continue to remix you.
Okay.
Okay?
Understood.
Okay, so we will go over how to use an EpiPen at this time, okay?
Okay.
Alrighty. So we have an EpiPen,
Okay.
and then we also have an AviQ. Are you familiar with either one?
A little bit more on the EpiPen, but not the AviQ.
Okay. So, you would use both of them in the same instance if you
Okay.
were having an anaphylactic reaction of any kind. So like your throat was closing up, your eyes were swelling shut, you felt any, symptoms like that, okay?
Okay.
So with the EpiPen, there are different brands. They come out with a generic now, so that's good. But they're all pretty much the same idea. Always think blue to the sky and orange to the thigh, okay?
Okay.
So blue to the sky, you're gonna pull the blue cap off first,
Okay.
and then just kind of with a swift swing,
Okay.
the orange is gonna go into your thigh.
Okay.
You'll hold it for 10 seconds,
Okay.
and then you can release.
Okay.
So if you need to use your EpiPen or AviQ, afterwards, always make sure that you call an ambulance or go to the ER because
Okay.
you will need to be monitored afterwards, okay?
Okay.
And then AviQ, same idea, it's just a newer kind of version of an EpiQ that
Okay.
they've come out with, but it talks to you. So yeah, it's a lot simpler because it's telling you what to do in the
Okay.
event of an emergency. So you pull it out.
This trainer contains no needle or drug and is for training purposes only. Do not use this trainer during an allergic emergency.
Okay, so it doesn't have anything on top to
If
pull
you
off,
are ready
but
to
it does have the
use,
bottom.
pull red safety guard down and off of this trainer.
Okay.
Place black end against outer thigh. Then push firmly until you reach
So you'll hear a click whenever you inject the AviQ.
Okay.
Okay? So just based on, usually your insurance or your pharmacy, depends on which one the PA will send in for you. If she does send in an AviQ, it usually comes from a mail order pharmacy.
Okay.
So just be looking for a phone call from them if
Okay.
they're gonna send that to you, okay?
Okay.
Okay, and then this right here is just your escalation schedule, going over how many drops you're gonna do per day. So today, which is day 1, you just have 1 drop in the office.
Okay.
Day 2, you'll do 2 drops at home. Day 3, you'll do 3. Day 4, you'll do 4. And then day 5, you'll be built up to your maintenance dose, which is
Okay.
5 drops. So day 5 forward, you'll do 5 drops every day,
Okay.
okay?
Mhm.
And I do recommend just doing them at the same time every day, just to
Okay.
kind of help you remember, okay? Alrighty, so this is just saying that you understand it's your responsibility to always have an EpiPen and for it not to be expired.
Okay.
If you do have one that does expire, give us a call, we'll send you a new prescription in. Okay. And then this is just written directions on using your EpiPen and then also on using the AviQ if you were to receive one of those.
Okay.
Okay?
Mhm.
Okay. This just tells a little bit about our surveys, which we will send out to your email after you've been on treatment for about 3 months.
Okay.
It's really just to monitor the cost, the convenience, and the benefits that you're seeing from your drops.
Okay.
So on our scale, if you score anything below a 7,
Mhm.
we'll give you a call and see what we can do to help you.
Okay.
Okay? Do you have any questions about anything?
I think the only question that I would have is, what are kind of general local reactions that patients see with using drops, if any?
Yeah, I can go over that with you. So right here on this form, you could just have any kind of swelling, usually in the mouth or the throat.
Okay.
Would be more localized since that is where you
Yeah.
are administering the drops.
Okay.
Possibly some bumps or hives, welts on your skin.
Okay.
But most of the local reactions are going to be the lips, the mouth, or the ears may itch
Itch or
or
swell.
swell.
Okay.
Yeah. And if you do have any reactions, feel free to give us a call and let us know what's going on.
Okay.
Otherwise, as long as you're taking your antihistamine every day,
Okay.
that should minimize any kind of risk that you have. But
Okay.
let us know if anything happens at home that you're concerned about.
I can do that.
Okay. Alrighty, and your timer is about to go off, so are you still feeling okay? No itching, nothing right now?
No, I feel fine.
Okay, alright. Well, I will get your drops wrapped up for you and
Okay.
we will get you checked out and ready to go home, okay?
Okay. Thank you so much.
You're welcome.